Good morning, everyone. As a physician deeply invested in both human performance and public health, I've witnessed firsthand the growing obsession with muscle gains and the massive industry that promises to accelerate it. Walk into any supplement store or scroll through fitness influencers' posts, and you'll be bombarded with powders, pills, and potions, all promising to turn you into a Greek god overnight. Here's the truth: most of them don't work. Some are harmless, some are dangerous, and just a few, are backed by real science. Today we'll focus on the muscle building supplements that actually work. No fluff, no hype, just facts. Creatine monohydrate is, without question, the most studied and scientifically validated supplement available for individuals seeking to increase muscle mass, strength, and exercise performance. As a physician with a strong interest in sports medicine and human physiology, I can confidently say that among all supplements marketed to fitness enthusiasts and athletes, creatine stands alone in terms of safety, efficacy, and long-term benefit when used appropriately. Creatine is a naturally occurring compound found in small amounts in foods such as red meat and fish, and it is also synthesized by the liver, kidneys, and pancreas. Inside the body, it is primarily stored in skeletal muscle in the form of phosphocreatine. During high-intensity, short-duration activities such as weightlifting, sprinting, or explosive sports movements, our muscles rely on a molecule called adenosine triphosphate (ATP) for energy. Unfortunately, ATP stores are limited and rapidly depleted during such efforts. This is where creatine supplementation becomes particularly valuable. By increasing the availability of phosphocreatine within muscle tissue, creatine supplementation allows for faster regeneration of ATP, enabling muscles to sustain high-intensity activity for longer durations and recover more rapidly between sets. This translates into measurable improvements in training performance, more repetitions, greater resistance, and improved muscular endurance. Over time, this enhanced training capacity contributes to more significant muscle hypertrophy and strength gains. Several meta-analyses and clinical trials have consistently shown that creatine monohydrate supplementation improves performance in resistance training by approximately 10–20% depending on the training protocol and baseline levels of muscle creatine saturation. Additionally, it is one of the few supplements that has demonstrated benefits across a wide range of populations, not only in young, healthy athletes but also in older adults, where it can help mitigate sarcopenia and support muscle preservation with aging. From a clinical safety perspective, creatine monohydrate is exceptionally well tolerated when used in standard doses. The typical recommendation is a daily dose of 3 to 5 grams, while some protocols involve a loading phase of 20 grams per day divided into 4 doses for 5 to 7 days. This is not necessary for most users. A single consistent daily dose leads to muscle saturation over several weeks without the risk of gastrointestinal discomfort that can sometimes accompany loading. Concerns about kidney damage, dehydration, or cramping have circulated widely, often rooted in anecdotal reports or misinformation. However, extensive research has failed to support these claims. In healthy individuals with normal renal function, long-term use of creatine does not adversely affect kidney or liver parameters. That said, as with any supplement, patients with pre-existing medical conditions, particularly those affecting the kidneys, should consult a healthcare provider before initiating supplementation. One of the great advantages of creatine monohydrate is its affordability and simplicity. Unlike many modern formulations that offer proprietary blends or buffered versions at inflated prices, plain creatine monohydrate powder is both effective and inexpensive. There is no need for complex delivery systems or additional ingredients. It dissolves easily in water or post-workout shake and integrates seamlessly into a daily supplement routine. Furthermore, creatine has emerging research suggesting cognitive benefits, particularly in settings of sleep deprivation or mental fatigue, though these effects are still under investigation and less conclusive than the robust muscular benefits. In conclusion, creatine monohydrate is a rare example of a supplement that consistently lives up to its claims. It is backed by decades of research, supported by sound physiological mechanisms, and proven to be both safe and effective for enhancing muscular strength, power, and growth. For anyone pursuing serious training goals, creatine is not only worthwhile, it is foundational. As with all interventions, it should complement, not replace, well-structured training, proper nutrition, and adequate rest, which remain the true pillars of physical development. Whey protein is one of the most effective and clinically supported supplements for individuals aiming to build and maintain muscle mass. As a physician, I often emphasize that while training provides the stimulus for muscle growth, it is recovery, and specifically the nutritional component of recovery, that allows hypertrophy to occur. Protein intake is central to this process. Among all dietary proteins, whey protein stands out for its superior amino acid profile, rapid absorption rate, and high bioavailability, making it an ideal tool to support muscle repair and synthesis following resistance training. Derived from milk during the cheese-making process, whey protein is a complete protein, meaning it contains all 9 essential amino acids that the human body cannot synthesize on its own. Of particular significance is its high concentration of leucine, a branched-chain amino acid that plays a pivotal role in initiating muscle protein synthesis (MPS). Leucine acts as a molecular switch triggering intracellular pathways, most notably the mTOR pathway that drives the anabolic processes required for muscle recovery and growth. Numerous randomized controlled trials have demonstrated that whey protein supplementation, particularly when consumed post-exercise, enhances muscle protein synthesis and leads to greater gains in lean body mass over time, especially when combined with resistance training. The anabolic window, the period post-exercise during which muscles are particularly responsive to nutrients, is an opportune time to ingest whey, as its rapid digestion leads to a swift increase in plasma amino acid levels, accelerating the repair and rebuilding of muscle fibers stressed during training. In practical terms, whey protein supplementation helps individuals consistently meet their daily protein requirements, which are often underconsumed, especially among those with higher physical activity levels. The general recommendation for individuals engaged in resistance training is approximately 1.6 to 2.2 grams of protein per kilogram of body weight per day. Meeting this requirement through whole food alone can be challenging due to time constraints, appetite variations, or dietary restrictions. Whey offers a convenient, portable, and efficient means to bridge that gap. It's also worth noting that whey protein has a favorable impact on body composition beyond just muscle building. Studies have indicated that when used as part of a calorie-controlled diet, whey protein can support fat loss while preserving lean mass. This is particularly important in populations such as athletes in cutting phases, older adults at risk sarcopenia, or clinical patients undergoing rehabilitation where maintaining muscle mass is crucial for metabolic health, mobility, and functional independence. From a safety perspective, whey protein is exceptionally well tolerated in most individuals. Concerns about kidney damage from high protein intake are largely unfounded in healthy populations. Clinical studies have repeatedly shown that increased protein intake, including from whey supplements, does not impair kidney function in individuals with normal renal health. However, those with pre-existing renal conditions should consult a physician before beginning high-protein regimens. There are different types of whey protein available on the market, namely whey protein concentrate, isolate, and hydrolysate. While all are effective, whey isolate is typically lower in lactose and fat, making it a better option for individuals with lactose intolerance or those seeking a leaner product. Hydrolysate is partially pre-digested and may be absorbed even more rapidly, but it tends to be more expensive and is not usually necessary for the average user. In conclusion, whey protein is a scientifically validated, safe, and practical supplement for supporting muscle growth, recovery, and overall performance. While not a substitute for a balanced diet rich in whole food sources of protein, it serves as a powerful adjunct, particularly in the peri-workout period. When used intelligently and consistently, whey protein can meaningfully enhance the results of a well-structured resistance training program, making it one of the few supplements that truly earns its place in a muscle-building regimen. Beta-alanine is a non-essential amino acid that plays a crucial role in enhancing muscular endurance and overall training performance, particularly during high intensity and moderate duration exercises. Unlike supplements that directly increase strength or muscle size through anabolic pathways, beta-alanine works by optimizing the internal chemical environment of the muscle cell, allowing for more efficient and prolonged performance during exercise. As a medical professional with an interest in sports physiology, I consider beta-alanine to be a well-substantiated, underutilized supplement that can meaningfully improve training outcomes when used appropriately. The primary mechanism by which beta-alanine exerts its effects is through its role in the synthesis of carnosine, a dipeptide composed of beta-alanine and histidine. Carnosine is stored in high concentrations in skeletal muscle and serves as a pH buffer, helping to neutralize hydrogen ions that accumulate during anaerobic metabolism. During high-intensity exercise such as resistance training, sprinting or circuit-style workouts, the breakdown of ATP and glycolysis produces lactic acid, which dissociates into lactate and hydrogen ions. The accumulation of hydrogen ions leads to a drop in intramuscular pH, a condition known as acidosis, which impairs muscle contraction, reduces force output, and contributes to the sensation of fatigue. By increasing the intramuscular concentration of carnosine, beta-alanine helps delay the onset of muscular acidosis, effectively allowing the muscle to perform at a higher intensity for a longer duration before fatigue sets in. This is particularly valuable in exercises lasting between 60 to 240 seconds, such as higher repetition strength training, metabolic conditioning circuits, or moderate distance sprinting. Although beta-alanine does not directly increase muscle mass or strength, its ability to improve training volume and quality can indirectly support hypertrophy and strength development over time. Clinical trials and meta-analyses have shown that beta-alanine supplementation can significantly increase muscle carnosine levels, typically by 40 to 80% after several weeks of consistent use. This elevation correlates with improved exercise capacity, particularly in activities requiring sustained effort and resistance to fatigue. For bodybuilders, athletes, and even older adults engaged in resistance training, the implications are clear. Greater training volume often leads to superior results in both strength and muscle hypertrophy. The standard dosing protocol involves taking 3.2 to 6.4 grams of beta-alanine per day, typically divided into smaller doses to minimize side effects. The most common side effect is paresthesia, a harmless tingling sensation in the skin, usually felt in the face, neck, or extremities. This sensation is dose-dependent and transient, often subsiding as the body becomes accustomed to the supplement. While not harmful, some individuals find it uncomfortable. Dividing the daily dose into 800 milligrams increments or using time-release formulations can mitigate this issue. It's important to understand that beta-alanine is not an acute performance enhancer. Rather, it requires consistent daily supplementation for several weeks to fully saturate muscle carnosine stores and exert its performance-enhancing effects. Unlike caffeine or creatine, the timing of beta-alanine ingestion is less critical. Whether taken pre-workout, post-workout, or with meals, the key is daily consistency over a period of 4 to 12 weeks. From a safety standpoint, beta-alanine has been extensively studied and found to be well tolerated in healthy populations. There is no evidence that it negatively affects organ function, hormonal balance, or long-term health when used within recommended dosages. As with any supplement, individuals with underlying medical conditions should consult a healthcare provider before beginning use, though the risk profile of beta-alanine is generally low. In summary, beta-alanine is a scientifically supported supplement that enhances muscular endurance by buffering intramuscular acidity, thereby extending time to fatigue during high-intensity training. While not directly anabolic, its ability to increase training volume makes it a valuable tool in any muscle building or performance enhancing program. When used consistently and intelligently, beta-alanine can be an effective adjunct to traditional training and nutrition strategies, helping individuals push harder, train longer, and ultimately achieve greater results. Caffeine is one of the most widely consumed psychoactive substances in the world, and its effects on physical performance, particularly in the context of resistance training and muscle development, are both well documented and clinically significant. While it is most commonly associated with increased alertness and wakefulness, caffeine's role in enhancing muscular performance should not be underestimated. As a physician, I view caffeine not merely as a stimulant but as a legitimate ergogenic aid that, when used correctly, can improve training quality and thereby indirectly contribute to muscle building outcomes. Caffeine exerts its effects by acting as an adenosine receptor antagonist. Adenosine is a neuromodulator that promotes relaxation and drowsiness by slowing down neural activity. When caffeine blocks adenosine receptors, it leads to increased neuronal firing and the release of neurotransmitters such as dopamine and norepinephrine, resulting in heightened alertness, reduced perception of fatigue, and improved mood. These central nervous system effects translate directly to enhanced motivation and drive during exercise, allowing individuals to train harder and longer with greater focus. From a physiological standpoint, caffeine has been shown to increase the release of calcium ions within muscle cells, thereby enhancing muscular contraction strength. Additionally, it promotes the mobilization of intracellular fat stores, providing an additional energy substrate and possibly sparing muscle glycogen during prolonged training sessions. Together, these mechanisms contribute to increased exercise capacity, particularly in high-intensity and endurance-based activities. In the context of resistance training, caffeine's primary benefit lies in its ability to reduce perceived exertion and delay the onset of muscular fatigue. This means that individuals are often able to complete more repetitions, lift heavier weights, or maintain higher levels of effort throughout the workout. Over time, this cumulative increase in training volume can significantly influence muscle hypertrophy and strength development. Several control studies have demonstrated that caffeine supplementation improves one repetition maximum strength, muscular endurance, and total work performed during weightlifting protocols. The effective dose of caffeine for performance enhancement is typically in the range of 3 to 6 milligrams per kilogram of body weight, taken approximately 30 to 60 minutes before exercise. For a 70 kilogram individual, this equates to about 210 to 420 milligrams of caffeine, roughly equivalent to 2 to 4 cups of strong coffee, or a standard dose found in most pre-workout supplements. It is important to note that individual sensitivity to caffeine can vary widely, and starting at the lower end of this dosing range is advisable, particularly for those unaccustomed to its effects. Despite its clear benefits, caffeine is not without its drawbacks, particularly when misused. Excessive intake can lead to symptoms such as jitteriness, anxiety, elevated heart rate, gastrointestinal discomfort, and in some cases, insomnia. These side effects are more pronounced in individuals with low caffeine tolerance or when doses exceed 6 milligrams per kilogram. Moreover, caffeine's half-life ranges from 3 to 7 hours depending on individual metabolism, meaning that late-day consumption can interfere with sleep quality, a factor that is critical for muscle recovery and growth. As such, I recommend avoiding caffeine intake within 6 hours of planned sleep to preserve circadian rhythm and sleep architecture. Another consideration is the potential for habituation. Regular caffeine users may develop some tolerance to its stimulant effects, requiring higher doses over time to achieve the same performance benefits. Fortunately, this tolerance is not complete, and the ergogenic effects of caffeine, particularly in physical performance, remain partially intact even with habitual use. Periodic cycling of caffeine for 1 to 2 weeks may help restore sensitivity in some individuals. In conclusion, caffeine is a potent, well-researched supplement that enhances both mental and physical aspects of exercise performance. By increasing alertness, reducing fatigue, and improving muscular output, caffeine allows individuals to train with greater intensity and endurance, factors that over time contribute to improved muscle growth and strength. When used responsibly and with awareness of individual tolerance and timing, caffeine can be an effective and safe tool within a comprehensive muscle building strategy. Omega-3 fatty acids, particularly the long-chain polyunsaturated fatty acids eicosapentaenoic acid EPA and docosahexaenoic acid DHA, have garnered widespread attention in clinical medicine for their role in cardiovascular, neurological, and inflammatory health. However, their relevance extends beyond disease prevention. Emerging evidence supports their utility in supporting muscle function, recovery, and even preservation of lean body mass. As a physician, I believe omega-3 supplementation is often overlooked in discussions surrounding muscle building, despite its broad and scientifically substantiated benefits for skeletal muscle physiology and recovery. The primary mechanism by which omega-3 fatty acids assist in muscle health lies in their potent anti-inflammatory effects. During resistance training, muscle fibers undergo microscopic damage, a normal and necessary stimulus for growth. However, excessive or prolonged inflammation can impair recovery, delay training progress, and contribute to overuse injuries. EPA and DHA help modulate the inflammatory response by competing with pro-inflammatory omega-6 fatty acids for enzymatic conversion pathways, ultimately leading to the production of less inflammatory eicosanoids. This leads to a more controlled, efficient recovery process post-exercise, allowing for faster return to training and improved muscle repair. Several clinical studies have demonstrated that omega-3 supplementation can reduce delayed onset muscle soreness, DOMS, and muscle stiffness following strenuous exercise. This is especially relevant for individuals engaging in high-volume or high-frequency training programs. The reduction in post-exercise soreness not only improves comfort and function, but may also allow athletes to maintain a higher training load over time, a critical factor in achieving hypertrophy and performance adaptations. In addition to their anti-inflammatory effects, omega-3 fatty acids also appear to enhance muscle protein synthesis (MPS), particularly in response to amino acid intake and resistance exercise. One notable study found that supplementation with 4 grams of combined EPA and DHA daily over 8 weeks significantly increased the muscle's anabolic response to protein feeding in both young and older adults. This suggests that omega-3s may act synergistically with dietary protein and resistance training to optimize muscle building outcomes. The preservation of muscle mass is not only important for athletes but also for older adults, patients recovering from illness, or individuals undergoing periods of immobilization or caloric restriction. Sarcopenia, the age-related loss of muscle mass and strength, is a major public health concern due to its association with frailty, falls, and metabolic decline. Omega-3 supplementation has shown promise in mitigating these losses by promoting muscle protein retention and improving neuromuscular function, particularly in elderly populations. As such, omega-3s offer dual utility, enhancing performance in younger individuals and preserving function and independence in aging populations. When it comes to dosage, the majority of studies demonstrating muscle-related benefits have used daily doses in the range of 2 to 4 grams of EPA and DHA combined. This is considerably higher than the typical intake from a standard Western diet, which averages less than 200 milligrams per day. While omega-3s can be obtained through fatty fish such as salmon, sardines, and mackerel, supplementation is often necessary to achieve therapeutic levels. Fish oil capsules or concentrated triglyceride form omega-3s are both effective options.
Safety is generally excellent, with omega-3s well tolerated in most individuals. Mild gastrointestinal symptoms such as fishy aftertaste or indigestion can occur but are minimized with enteric-coated formulations or by taking the supplement with meals. At higher doses, omega-3s can have mild blood thinning effects, so individuals taking anticoagulant medications or preparing for surgery should consult a healthcare provider prior to starting high-dose supplementation.
In summary, omega-3 fatty acids are a valuable evidence-based addition to a muscle building and recovery strategy. Through their anti-inflammatory properties, ability to support muscle protein synthesis, and protective effects on lean mass during aging or inactivity, they offer comprehensive benefits that go beyond traditional ergogenic aids. Whether you are a strength athlete, an aging adult, or someone in rehabilitation, omega-3s represent a safe and effective supplement that supports both immediate performance and long-term musculoskeletal health. Vitamin D, while often associated with bone health, plays a far more expansive and critical role in overall human physiology, including muscle function, immune regulation, and hormonal balance. In the context of muscle building, vitamin D deserves serious attention, not as a direct anabolic agent, but as a fundamental factor that supports the systems necessary for optimal performance, recovery, and strength development. As a physician, I frequently evaluate vitamin D status in patients with unexplained fatigue, musculoskeletal discomfort, or poor training progress, and it's surprising how often deficiency is a silent contributor. Vitamin D is unique in that it functions more like a hormone than a traditional nutrient. Synthesized in the skin upon exposure to ultraviolet B, UVB rays from sunlight, it undergoes conversion in the liver and kidneys to its active form, calcitriol. This active form binds to vitamin D receptors, VDRs, which are present in nearly every tissue in the body, including skeletal muscle. The presence of these receptors within muscle cells underscores the vitamin's importance in muscular health. Numerous studies have shown a correlation between adequate vitamin D levels and improved muscle strength, power, and function. One of the key mechanisms is through its regulation of calcium and phosphate metabolism, both of which are critical for muscle contraction. Calcium is essential for initiating the interaction between actin and myosin, the proteins responsible for muscle contraction. Without optimal vitamin D levels, calcium handling within muscle cells becomes inefficient, leading to subpar performance and delayed recovery. Moreover, vitamin D influences muscle protein synthesis by modulating anabolic signaling pathways. Research indicates that individuals with sufficient vitamin D status respond more favorably to resistance training than those who are deficient. In fact, vitamin D deficiency has been associated with reduced muscle mass, increased fat accumulation, and even higher risk of sarcopenia in older adults. While vitamin D is not a performance enhancer in the way creatine or caffeine might be, it provides the biochemical environment necessary for those substances and your own body to work efficiently. Perhaps most critically, vitamin D also plays an important role in immune function. Intense training, particularly when not paired with adequate recovery, can suppress the immune system, leaving athletes more susceptible to illness. Even mild infections can disrupt training schedules and compromise consistency. Vitamin D enhances the innate immune response while modulating inflammation, striking a balance that keeps the body resilient under the stress of repeated physical exertion. The hormonal implications of vitamin D are another key area of interest. Several studies have noted that adequate vitamin D levels may support healthy testosterone production, particularly in men. While the evidence is mixed and vitamin D should not be considered a replacement for hormone therapy in deficient individuals, the relationship is biologically plausible given the expression of VDRs in Leydig cells of the testes. In this light, vitamin D may help support an optimal hormonal environment for muscle growth. From a public health standpoint, vitamin D deficiency is incredibly common, especially in regions with limited sunlight during winter months, or in individuals with darker skin pigmentation, higher body fat, or those who spend most of their time indoors. Symptoms of deficiency are often vague: fatigue, low mood, diffuse aches, and may be misattributed to overtraining or poor sleep. For those engaged in serious training, optimizing vitamin D status is both a performance and a recovery consideration. For most adults, a blood level of 25 hydroxyvitamin D, 25 OHD of at least 30 mg/ml is considered sufficient, though many experts advocate for levels closer to 40-60 mg/ml in athletic populations. Supplementation of 1000 to 4000 IU per day is commonly recommended depending on baseline levels, body weight, sun exposure, and individual needs. Importantly, vitamin D should be taken with dietary fat to enhance absorption. In conclusion, vitamin D is a foundational supplement, not because it builds muscle directly, but because it ensures that the metabolic, immune, and hormonal processes involved in muscle growth and repair function optimally. Ignoring vitamin D status can limit progress, increase injury risk, and impair recovery even in the presence of otherwise excellent training and nutrition. It is not just a wellness vitamin, it is a performance factor and one that merits routine consideration for anyone serious about muscle building. Supplements can enhance muscle growth, but only when your training, nutrition, sleep, and consistency are already in place. If you're skipping workouts, neglecting sleep, or eating like a teenager with a credit card, no supplement on earth is going to compensate. As a doctor, I urge you to treat your body with the same care and critical thinking you'd expect from a medical professional. Use what works, ignore what doesn't. And above all, train smart, eat well, and be patient. Muscle isn't built overnight, but with the right tools, it absolutely can be built. Thank you.